Prime Minister Boris Johnson has been admitted to hospital 10 days after testing positive for the coronavirus. For more on this, let's bring in Maryam Namazi. She's joining us from London via Skype. What more are you hearing about the Prime Minister's condition, Maryam?
Right. So we have learnt this evening that Prime Minister Boris Johnson, as you say, has been admitted to hospital. This is after having symptoms of the coronavirus for the past 10 days, which he tested positive for. It's worth mentioning that it's not an emergency admission. Currently, we just know that he has been admitted to hospital for tests, and that's pretty much the extent of it. A spokesperson from Downing Street has released a statement saying that he was admitted to hospital on the advice of his doctor, and it's been described as a precautionary step that has been taken because of the persistent nature of his symptoms. But interesting that he still remains very much in charge of the business of government and is still in contact with ministers and officials. And that is something that Downing Street has really emphasized. Of course, Boris Johnson has been working remotely for the past 10 days. He has been in isolation, working from the flat above number 11 Downing Street. And he has been having phone calls and conducting meetings remotely and conducting cabinet meetings. And he's also been on social media delivering messages to the public about the importance of social distancing and really making the point that he is still very much in the driving seat and still very much in charge of the fight against the coronavirus. But of course, there will be a great deal of curiosity and speculation as to why he has been admitted to hospital now. This is what we don't know at the moment, why he has been admitted to hospital. Is it that his symptoms have deteriorated? Is it perhaps a logistical thing because he would be able to access medical advice and be able to access specialists that he wouldn't otherwise be able to? Or is it just that the symptoms are persistent? But right now, he remains very much in charge of the government. Now, it was on March 27th that we learnt of Boris Johnson and the Health Secretary, Matt Hancock, testing positive for the coronavirus after experiencing mild symptoms. Of course, Matt Hancock is now back at work. He is one of the key faces in those daily government briefings. We get updates about where the country is with the epidemic. But Boris Johnson has remained in isolation. It was interesting because when that news came through on March 27th, there was really a flurry of questions about who these two had been in contact with in Westminster, whether other government ministers and other officials might have been infected, and concern that perhaps government officials had not been following their own advice on social distancing. And then there were also questions about contingency measures, about backup plans. What happens if the Prime Minister is incapacitated? And we know that in that scenario, it would be the Foreign Minister, Dominic Raab, who would take charge. But right now, as far as we know, it is the Prime Minister who is still very much in charge. This evening, he has been admitted into hospital. We don't know precisely why, but it is the persistent nature of his coronavirus symptoms that has prompted this.
All right, Maryam Namazi, thank you very much.